In this video, I'm going to discuss a really cool test you can use to check your heart health. And at the end, I'm going to tell you a really cool thing you can do to improve your heart health. How to protect your heart health. I'm Junior Gupta, the founder of LifeHeal. At LifeHeal, we look at all the latest research at reversing metabolic disease, whether that is cardiac disease, diabetes, blood pressure, fatty liver. We look at all the new research coming out and how you can implement them in your life. Today we're going to discuss a really important test which will reveal your heart health. Now, just know that I'm giving you my opinion on YouTube. Please be responsible for your own health and your own health decisions. Now, what is the challenge traditionally at finding out about your heart health? The challenge is that the traditional tests for heart health don't really reveal what's going on. Now, when I say heart health, I mean your cardiovascular system, the plaque which leads to heart attacks. So it's very hard for us to find out. You can do a cholesterol test, you can take cholesterol lowering drugs, but you don't really know the end result. And typically the angiography, the test which is done at a pretty late stage, all that reveals is if you need a stent or if you need a bypass. Because angiography is normally done when you are already having quite advanced symptoms. So that is the big failure with angiography. You cannot use it as a preventative test. So what if I told you that there is a simple non-invasive test you can do which will tell you how your arteries are doing right now? So this test is called the Carotid Intima Media Thickness, and it's a long name, I agree. So what we are doing in this test is we are looking at these arteries. So these arteries are right at the surface of your skin, and they are major arteries because these arteries supply the blood to the brain. So these are called the carotid arteries, and the carotid arteries are extremely important. You can't afford these getting cut or anything. They're hardcore. So you can check these arteries very well, very easily. And again, the test is the Carotid Intima Media Thickness, and I've put the name in the YouTube, in the video below, in the description below. So the advantage of this is that, and I've got my test here, is that you get a really good picture of your arteries. And because they are so close to the heart, you have a really good idea how your heart could be doing. What I mean to say is, if these are in good shape, it's very likely that these are in good shape. If these are in bad shape, plaque, thickening, it's very likely that these are also in bad shape. So what you get in this test is really good photographs of your arteries, of the plaque and of the thickening. And it alerts the physician beforehand while you are still asymptomatic. Now the main advantages of this test is that it is an ultrasound. There is no X-ray radiation. It is non-invasive. And at the time of recording this video, it cost me 2,000 rupees to get this done. So it is very cheap. So for anybody who is over 45, who has a history of heart disease and their family, I highly recommend getting this test done. Now, I want to share two personal experiences, and I will deviate a bit from the test, but I'll still talk about heart health. Now, if you like these experiences, please put it in the comments below. If you don't like me deviating, please put it in the comments below so I can improve my videos. Now, the first experience I will share is when I got these tests done. So when I got these tests done, they were at a mid-sized hospital in Lucknow. Firstly, the doctor said, "Aap yahan kyun aaye ho? Why are you here?" Because I was self-prescribed. I said, "Just to have this checked." He said, "Are you sick?" "No." "Then why are you here?" And that is the problem with the mainstream medical system. First you get sick, then we treat. This notion of preventative health is really very rare. So going on to the story, the experience that I wanted to share, however, this is part of that. After I got my ultrasound, the doctor screams like, whatever he screams, but basically telling me I need to get on drugs, I need to get on medication, everything is going wrong, and it just was not a good picture. 2 days later, I go to one of the top cardiologists in Lucknow, who happens to be a friend, and I showed him this test and a second test which I had gotten done. And he says to me, "Junior, you are better than a newborn." So how do we go from all hell has broken loose to you are better than a newborn within 48 hours? And so what I want to tell you from this story of mine is that the cardiologist that you go to matters. And today in India, you can go to cardiologists in any city because of telehealth. So make sure you go to a good doctor. The quality of your doctor matters. You don't need to be taking drugs unnecessarily. There's a lot of new research going on around cholesterol and whether it really is harmful for you. So you want to go to somebody who has knowledge of today's science and not 20 years ago. The second experience, and this is much more personal. So I always hear stories that, oh, Mr. Sinha, Mr. Verma, Agarwal uncle, he went to the cardiologist and he had 98% blockage and he needs a bypass. 99% blockage, 97% blockage, immediately bypass. And of course, normally there is a stent in the should we say, less severe cases. But they're always 95% blockage and above. And I'm like, if this cardiologist is so good, why didn't he catch him at 70% blockage? Why didn't he catch him at 70 and then say, okay, now Mr. Verma is down to 50? It's always like something is really bad and we need to do a really major surgery. And my dad had 2 bypass surgeries. And nobody ever told him that you can reverse plaque. And so that's my personal story. Why is cardiology always so reactive? We should have it be more preventative. You should be able to check where you are at a much earlier stage, and you shouldn't need a stent. You shouldn't need a bypass surgery. You should be able to reverse your plaque deposits through natural therapies. And if your doctor, all he knows is medications, then please come to somebody like us, or there might be other places as well around the world that you can consider. Can you reverse heart disease? Yes. Yes, yes, and yes. There's more and more research happening around the world that shows that heart disease can be reversed. In US, Dr. Dean Ornish has published a lot of papers, has also been on TED Talks and various other shows where he shows the reversal of arterial disease. He shows plaque deposit reversal and also the artery getting healthier, getting fuller, supple, less twisty, just getting younger. In our case, we also have patients where they no longer need a bypass. So we have a patient who needed a bypass 2 years ago, within a month, and I went with him to the cardiologist. When we were doing the echocardiogram, the cardiologist said, "This is a healthy heart. We do not need a bypass." The final point related to this is exercise versus diet for your health. A lot of people watching this video about heart health must also be facing an issue about obesity. We normally see that in our patients. So they always think they need to exercise more. Now, I want to set the record straight. Exercise is good for your muscles. You want to build muscles, it's very good. You want to do cardio exercise like a lot of cycling and build your heart muscle endurance, that's cardio. You can do yoga for your flexibility. But if you want to heal your arteries, if you want to heal a fatty liver, it is food. And even for weight loss, we consider 95% of the effort to be food and 5% to be exercise. So this is the summation of exercise versus food, in case you were wondering. I hope you found this video extremely helpful, and I hope I can help you have better cardiovascular health through the knowledge that I've shared. If you like this video, please hit like, do subscribe to our channel, hit that bell icon as I make more videos around preventative health. Thank you.